introduce today, our speaker today is Ms. Kristina Wolfe. She's a licensed physical therapist and she is the founder of Prosper PT and Wellness. She specializes in fall prevention, health education, and wellness. She really emphasizes participation in healthy aging services through Prosper and aims to improve your physical health in many ways by group wellness, one-on-one wellness, fall prevention, and recovery training, walking groups, Tai Chi, and activator pole classes. So she does have some activities for you all today. So would you please just give a hearty welcome to Ms. Kristina Wolfe.
Thank you for having me. Are you good to go, Chris? Yes? Awesome. Okay. I am going to do my best to not make this table fall over and still face you and read my notes. So I'm very happy to be here with you. I love these Paths to Wellness programs. I was actually a lead in the Falls Risk program that we have here. So I think this is really good work, and I'm glad that you've dedicated your time to learning more and more about this health process. So, I've already been introduced, but that's me. Frank likes to ask if that young version of me is still me, but it's me. It's only 3 years ago. But yes, I am a physical therapist. I've been practicing physical therapy since 1997, and I've been in a variety of settings, all over the place, really. And my passion is for prevention. It always has been. I've always wanted to help people before they really need physical therapy skills, but there's just not a lot of clinics set up to do that because insurance doesn't really like to pay for prevention, except for diabetes. They do like to pay for that sort of stuff with the nutrition and all the things that they do. So I have my own business for prevention and healthy aging, which is like wellness activities, exercise classes, and all of that sort of stuff. So feel free to come up and get some more of my information later if you're interested in learning more about me. I also have information up here about Standing Strong North Carolina, which is a fall prevention organization, and Healthy Aging NC, if you don't know of them. They are an organization here in North Carolina that helps you to understand more about yourself and your aging, and one of their classes is a healthy aging on diabetes. So if you're interested in learning more after this is over, you can go on their site and get some information. So moving on, I was asked to talk about neuropathy in regards to diabetes. And I know a little bit about neuropathy as a physical therapist because it is one of the conditions that we work with pretty often, the peripheral neuropathy. But I was surprised to find out how many different kinds of diabetic neuropathy that there are. So, as you can see on here, diabetic neuropathy is nerve damage that is caused by diabetes, whereas neuropathy is just nerve damage. It can be caused by all kinds of things. There are 4 different types of diabetic neuropathy: peripheral, autonomic, focal, and proximal. And I'm going to go into the first 2 a little bit more on another slide. But let me go through focal neuropathies, and proximal neuropathies are less common. So the most common kind of a focal neuropathy is carpal tunnel syndrome. Anybody ever had carpal tunnel syndrome? Okay. So, yeah. So that's considered a focal neuropathy. And a proximal neuropathy is similar in that it targets a nerve, but is more at the proximal end, which is closer to the body, where this is distal. So carpal tunnel is a distal focal neuropathy. So the focal neuropathy that is most common is carpal tunnel syndrome, with approximately 25% of people with diabetes having some nerve compression at the wrist. All right.
I don't understand how diabetes can create that problem.
Diabetes causes all kinds of things. Yeah. That inflammation, the blood sugar, and how it changes the tissues in the body. It changes all kinds of things. Yeah.
That affects the nerve.
It affects so think about it this way. Carpal tunnel syndrome, we always think about it more related to somebody that has a desk job, right? Computer typing, right? And that is external pressure on the carpal tunnel where the nerves go through to the hand. So that external pressure causes carpal tunnel syndrome. As I understand diabetes, it is a very inflammatory process in your body. So internally, you're putting pressure on that carpal tunnel syndrome, which is causing the nerve to get a little off.
Breaks the inflammation.
Yes, and tissue changes, yes.
And see, for me, I mean, I had carpal tunnel before I had diabetes, because I've been a secretary all my life. So
Yes.
It's been a long time, and back in the day, they didn't have no ergonomics thing and all that stuff, so.
Right, exactly. Yeah, so carpal tunnel is just one of the most common focal neuropathies, and it is found in people with diabetes as well. So let me go through these definitions for you. So these are the other two. Peripheral neuropathy, according to NIH, is nerve damage that typically affects the feet and legs and sometimes affects the hands and arms. 1/3 to 1/2 of people with diabetes have this type of neuropathy. Does anybody have peripheral neuropathy in this room? Do you know what I'm talking about?
I've not been diagnosed, but I think I have.
Yeah, you have it, yeah.
Yeah, I use the wellness mat for mine, it helps a lot.
Good. So autonomic neuropathy was something I was unaware of until I started this presentation. And it is found in more than 30% of people with diabetes. And autonomic neuropathy is damage to the nerves that control your internal organs. So this can lead to problems with your heart rate, blood pressure, digestion, bladder, sex organs, sweat glands, and your eyes. It can also lead to hypoglycemia unawareness, where your ability to tell if your blood sugar is low is diminished, which is really important for you to be able to tell that. So you can probably already tell that both of these types of neuropathy can be difficult to live with. Let's talk a bit more about what impact they may have on someone's life.
I'm going to take a picture of that.
Oh, sure, absolutely. Here, let me take that. And if it's possible, I'll be happy to send my slides to the class if you have do you have an email group? Yeah?
Yeah, they have emails on it.
Okay, perfect. I'll send my slides to all of you after
Oh, thank
this
you.
class. For sure, absolutely. Okay, so peripheral neuropathy. This is my wheelhouse as a PT. I understand that there are other types of diabetic neuropathy, but if you want to ask me questions about neuropathy, I'm not going to have much knowledge on the other ones except for this one. Talk to your neurologist or your physician about the other ones, though, if you have questions, because it is important to get as much knowledge as you possibly can. So, peripheral neuropathy. The damage to the nerves in the legs and feet can lead to increased risk of ulcers, sores, and infections due to lack of sensation and awareness of something causing damage to the skin. So how does that happen? Do you have any ideas of how this might occur to somebody's feet and legs?
Lack of feeling.
Lack of feeling, right? So say you are taking an exercise class and you have your tennis shoes on and you've been exercising for an hour and you might have had some swelling in your feet during that time. And then you just have to get your errands done. So you run your errands after you leave your class, and then by the time you take your shoes off, the pressure from the seams of your shoes can cause damage to your skin to the extent of a sore or an ulcer, but you didn't even know it was happening because the peripheral neuropathy kept you from being able to feel it. So it's super important that people with diabetes take a look at their feet regularly. They are the furthest most point away from the heart, right? So the blood flow and the circulation that gets down there and back up, it's slower. It goes, it definitely gets there, but you want to really pay attention to your feet. So what are some ways that you could check on your skin on a daily basis?
Taking a bath or shower.
Yeah, so bath or shower, take a look at them, inspect them. If you don't have the flexibility to look at the bottom of your feet, they make long-handled magnifying mirrors. I highly recommend investing in one so that you can see what's going on in the bottom of your feet. Another thing that can happen, you could be walking in your home and maybe somebody before you dropped a glass and they picked up everything that they could see, but there was a shard of glass that just didn't get noticed. You walk through, you step on that shard of glass, you don't know what's in your foot.
That's why you wear slippers.
That's why you wear slippers. Yes, absolutely.
Diabetics especially.
What's that?
Diabetics especially.
Yes, absolutely. Absolutely, but that's the point. Like if you can't tell that you've stepped on something, the only way you're gonna know that there's a problem is to look. You've gotta inspect your feet. Another recommendation on that is to see a podiatrist or some sort of foot doctor that is taking a look at your feet regularly. Know that some insurance companies even will give you a stipend for shoes, diabetic shoes that are appropriate for diabetics to wear. Yes, ma'am.
Podiatrists, we have them in this area?
Yes. Yes, we do. Yes. Yeah, share. You guys should share with them, one another, like resources and things.
We need to have other sessions other than the classes to be able to share information.
Yes, like social or something like that. Absolutely. Okay, so we talked about wearing shoes that are too tight that cause sores, stepping on something sharp, or hot. I mean, you could even step on something hot. Yes, ma'am.
Because of the peripheral neuropathy, but I also have ingrown toenails, so I make sure that I go to a podiatrist to cut it.
Excellent.
Because if I cut it myself, I may affect my
Yes.
toe and get them in trouble.
Good for you. I'm so glad that you're taking that precaution. You're being proactive, see?
Yeah.
Very good. So another condition that I thought of in the winter time and even sometimes in the summertime, we can get cracked skin on our feet from the weather or from the shoes that we decided to wear. If you're ending up in flip-flops or slippers like that, sometimes you can get a callus on your foot from those types of shoes. And so it's really important, not even just when you have gone barefoot, but any time of year to check your feet, okay? All right, so we talked about how important it is, magnifying mirrors, getting in check with your physician, and finding out about shoes that you can be prescribed. So here we are, number 2. Nerve damage can also lead to difficulty with balance and coordination that leads to a greater risk for falls and fractures. So there was a reason why I identified myself as the leader for the falls risk path to wellness, because this is my passion. I love to help people prevent falls. And people with diabetes are not immune to falls. I mean, we all are at risk for falls. We are at an increased risk when we hit age 65, but when you have peripheral neuropathy, you're at an increased risk for falls. So we're going to talk a little bit about why that is. When you can't feel your foot hit the ground, it doesn't send all of the same information up to the brain to tell you what that ground is like, right? So if we're outside here and it's a pretty decent parking lot, but there are spaces that there's a dip in the sidewalk, or you have to go off the curb and there's that little slant from the asphalt where it meets the concrete curb, right? If your foot hits that and it doesn't understand that that's what it's on, your balance is going to possibly be impacted by it. So there's a lot that you can do to compensate. We can't change the peripheral neuropathy necessarily, other than maybe to slow the progression of it, but there's a lot of things you can do to compensate for it.
If you go to an endocrinologist, they check your feet with the prick.
Yes,
With the prick too.
yes, that's one of the ways to get diagnosed is they have a monofilament or a microfilament testing, and they take these tiny little, it almost looks like spaghetti, hard, uncooked spaghetti to me, like of different diameters, and they take it and they touch it to your skin to find out if you have sensation in the hole of your foot. And it can go all the way up to your legs. So I've had people tell me, oh, I feel like I've got low-cut socks on all day, or I've got knee highs on all day long. That's where my neuropathy ends, is right up here. So, yes?
And it's funny because I just spoke to my general practitioner and he specializes in diabetes and he does that.
Yeah,
that's good.
You know.
Yeah, that's
I don't
very
look
good.
at it, But, yeah.
Yeah. I would say the point of all of that is to just know where you are today and to be aware that it's a possibility. You may not have it right now, but to know that it is a very prevalent thing when you have diabetes, that you want to make sure that you're proactive and you advocate for yourself and say, hey, you know what, I heard about this testing that you can do to see if I have neuropathy. Can you do that here, or do I need to go somewhere else? So the other part of peripheral neuropathy that I want to just touch base on is your reflexes. Okay, so those are because of your nerves too, and the conduction between the nerves and your muscles. So if your nerves are damaged from the diabetes, then your reflexes might not be all that sharp either, which is going to take you longer to correct an imbalance. So we want to make sure that you put things in place that are going to help keep you from falling and injuring yourself, specifically falling in fractures, right? And then the last thing, neuropathy can also cause pain. There's a lot of reports to me that the nerve sensation, it feels like I have burning in my legs all the time.
Oh, that's what that is?
Mm-hmm. Yes?
I have that because, and it's in my knee. I have 2 knee replacements, and this one I developed RSVS, which is
Yeah.
reflex sympathetic
Just,
dystrophy.
yeah.
I've been wearing my cryo cuff for the past 25 years.
Oh my goodness. Yeah.
And you travel with me in the Bahamas and in England and everywhere.
Right. So nerves are responsible for our strength of our muscles. They're responsible for telling us whether something's hot or cold. They're responsible for telling us if that's a light touch or a deep pressure. There's a lot of things that our nerves do. And so when they're damaged, they may go through this little cycle of, oh, let me just highlight this aspect of what I do. And so burning sensation is what I hear a lot about. Or it just hurts, or it feels like it's itchy all the time. I mean, there's lots of different ways that it presents itself, but if you notice that you're having a consistent feeling of some sort that doesn't seem normal to you, go see your physician and say, hey, what is this? What's happening to me? So it's good to find out all that you can. Let's see. Okay, and then the other thing is that physical therapists are movement experts. We are trained to identify all kinds of reasons why you're not moving around the way you want to. Like we said, we can't make the peripheral neuropathy go away, but we can do all kinds of things to help you correct your balance, your strength, just to impact your confidence level of how you're moving about. Once you get a lot of knowledge, you need to not just sit in the knowledge, you need to do something about the knowledge that you've gained. Otherwise, fear can keep you from doing all kinds of things. And we never want to give you so much information that you are anxious about it. We want you to have ways to impact your health. So, seeing a physical therapist in this state, North Carolina is a direct access state. So you can just go in and see a physical therapist. Whatever clinic you decide you want to go to, just walk in and say, hey, I want an appointment. I have balance and walking concerns, and I want to see you for physical therapy. They may have practices in their office where they say, well, I want you to get an order from your doctor first, but most places will do that in the background for you because we are direct access. We know what we're doing, and we can really do a lot and help you quite a bit.
Will your insurance normally cover that?
Yes, insurance will cover for medical necessity, right? So you have to have a reason why this is happening to you. It can't just be like, oh, I want to run a 5K and I want you to come alongside me while I'm doing this goal of mine and I need physical therapy to help me learn how to run this 5K. No, it has to be more like medically necessary. Like
So
I
as
want
long
to
as
prevent
you're
falls.
dealing with diabetic issues, your insurance. will
Yes,
cover you.
that's an underlying diagnosis that should cover you to go to physical therapy for balance issues, for sure. Even weakness. I mean, when, like I said, the nerve is responsible for a lot. It's responsible for your strength too. So if you notice that your ankles just don't feel strong anymore, go see, or your lower legs, anywhere really, go see a physical therapist. They will help you develop an exercise routine specifically targeted to those muscles that are weak.
So
Okay?
you do not need a doctor's order.
Not in North
Diagnosis
Carolina.
of neuropathy.
No, not in North Carolina.
Not, I can just say, well, I want to see a physical therapist, we'll direct her to a physical therapist.
Yes, ma'am. Yes, ma'am. You do need to say why you want to see the physical therapist. So they don't just want to be like, hi. But yes, you should be able to go directly to one. I worked for a large hospital system in the area, and even though we are a direct access state, they require a doctor's order to be seen by physical
So you have to
therapy.
be referred, basically.
At that large hospital system, that was their policy. They required a doctor's order, but the state of North Carolina does not. So depends on where you go, I should say. Okay, so just go in, say what you want to do physical therapy. They'll direct you from there. Okay, but I do recommend that you go in annually, just like we get our teeth cleaned twice a year and our eyes checked yearly. We should get our mobility checked yearly. Okay.
How often should you go to the podiatrist?
I don't know. Do you know how often they recommend you go to podiatry? Is it like quarterly?
I only go if I have a problem and I see that my nails are growing.
Yes,
inward,
yes.
and the cut, but maybe like every 6 months if you have a problem. Otherwise, 3 years.
Every 3 weeks. Yes. Oh, every 3 months. Okay, yeah, I was thinking quarterly or every 6 weeks or so is what I recall from the clients that I've worked with in the past.
I
But-
go twice a year because I have arthritis and I get shots from that.
Okay.
So I don't know sometimes whether it's arthritis or neuropathy.
Yeah.
Because they kind of feel the same.
Yes.
Yeah.
Okay. Wow.
So shots.
There's another thing that I know about, but I only know enough to be dangerous. There's a device that has just come out on the market, and it's like an ankle weight. Like you put it on like an ankle weight or an ankle cuff, and it has some sort of vibration tool in it that helps you to realize that's where your leg is. So every time you're moving, it vibrates, it tells you, okay, yeah, so you'll be more aware of what your legs are doing in space, and it helps you with your balance. So, like I said, I just learned about it. That would be something to ask your PT about when you go. But it is out on the market, and I've seen a few people in the wild, as I like to say, actually using it. It's not the rep telling me how great it is, but actual people using it, and they've said a lot of good things about it. So, something to think about. All right, next slide. So, another way we can impact our peripheral neuropathy and diabetes is through physical activity. So you see, there's all kinds of physical activity. We can do activity aerobic, we can do strength, there's all kinds of physical activity. And we know it's good for us, right? But why? Why is it good for us? And why is it important for someone with diabetes, do you think? Keeps you moving around, yes?
Your blood circulation.
Good, yeah, good blood
They
circulation.
said that kind of exercise acts like an insulin.
Acts like an insulin. Yes, yes, yes. So physical activity actually increases your insulin efficiency. So we want to do that specifically for diabetes, right? We want to make sure that you are controlling your blood sugar. So physical activity in general is good for our whole body. It's our muscle to fat ratio is impacted by it, our brain and our gut health, our mental health. So even just getting out and taking a walk can be good for our mental health, reduce stress. It's good for our heart. So blood glucose regulation or glycemic control. is really what we're coming down to with diabetes and why it's important for physical activity to be a part of your weekly regimen. All right, so regulating the blood glucose has a domino effect on all the other areas of the body that can be impacted by diabetes. It can reduce the risk for cardiovascular disease and the risk for developing depression, just to name a couple of things. And does anybody know what the recommended dosage is for a week-long physical activity regimen? Frank, you should know this.
150 minutes.
150 minutes. Yes, 150 minutes of moderate physical activity. Okay, so I put in here what is considered moderate physical activity up in the aerobic category. So walking briskly, tennis doubles. So tennis singles is actually what we would consider vigorous physical activity, but doubles would be considered moderate physical activity. Bicycling at a decent pace, not just leisurely bicycling, but bicycling at a decent pace. And then it's important to do 150 minutes of moderate physical activity, but also get in 2 to 3 days of strength training. Not on the same consecutive days. So you don't want to strength train Monday, Tuesday, Wednesday. You want to strength train Monday, Wednesday, Friday if you can, unless you're doing completely different body parts each day, okay? Because there's a rest period that muscles need in order to actually become stronger. Strength training, when you're doing it right, is a challenging act for your muscle group. So if we're lifting 1 pound and that's easy, we're not really going to be impacting the muscle to get stronger as if we were to lift 10 pounds and we can only lift 10 pounds 5 times, but we can really barely feel it finally got it up there. Then we've impacted the muscle. It's going to get stronger if you give it the rest period to, redesign the muscle fibers and everything that was being activated during your strength training exercise. Does that make sense? That's why we want to do it on non-consecutive days. If you want to do arms on Monday, you can do legs on Tuesday, and then you can go back to arms on Wednesday and legs on Thursday. You can strength train every day if you just do different body parts. But remember that the reason you're doing it is not just for getting stronger, it's to help regulate your blood glucose, okay? I highly recommend, if you haven't started an exercise activity, to go alongside somebody who understands diabetes and can help you to understand your body and your symptoms and give you an exercise routine that works best for you.
So where are we supposed to find that person?
Well, I think that you should talk to your physician first, or if you go to your physical therapist for your balance assessment or strength assessment, whatever you're going for, they can start you on a routine. Physical therapists have enough education to monitor your symptoms, check on your vital signs and all the things that are going on with you while you're exercising, and help you find a balance that works for your system.
So what if you're not going to go to the therapist? How do you find that person?
I would recommend that you see somebody like that first. You could try to look in the community to see if there's physical trainers that might have that knowledge, but I would recommend seeing somebody that has specific understanding of what it's like to exercise when you have diabetes.
Not an individual, but I take, to me, it's like PT exercises 3 hours a week here at the senior center.
Well, I have a trainer, but I was just wondering, she was talking about someone who has knowledge of diabetes. That's what I was trying to get to.
Yeah, and maybe your trainer does.
One here that had that is John, working with John. He was in the diabetes class. He has that.
Yeah, there's probably, you could even ask your trainer, just, what is your background? Do you have any education in diabetes, and can you coach me on how to improve my my exercise routine safely? That's really what it comes down to. So, but if you haven't adapted physical activity into your weekly routine, really it's just start where you are, right? You don't have to get 150 minutes You just start by reducing your sedentary time by 30 minutes a day, right? So when you were gonna sit and read that book for an extra 30 minutes, you're just gonna say, nope, I'm gonna get up and I'll walk around for a little while instead, or I'll take care of, errands that I needed to do, or something like that. So just reduce your sedentary time just to get started. Get up and move, all right? And I read in your, you guys have those binders? So I looked in your booklet, and on page 33, it said that people who engage in more than 150 minutes a week, so overachievers, right? They have even greater reductions in their A1C than those who exercise less than 150 minutes a week. Yes?
One of our girls, well, she's not here today, but she walks every single day, and she has not had any problem in her diabetes in years.
That's fantastic.
Because she walks every single day.
Wow, that's good. See, like I said, in the wild, it actually works.
You said page 33?
What's that?
You said page 33?
Page 33, yes. And your book gives plenty of detail about physical activity, so please read it when you have a moment. I'm just going to go ahead and highlight a couple of, or at least a few reasons why I like being physically active and how I go about doing that. And this is close to the end of our presentation. So, pole walking. Has anybody ever seen this? Yeah. Okay, have you tried it? Yes? Okay. All right, so Nordic walking or pole walking has been around for ages, and it's becoming more and more popular in the U.S. So the reasons why I enjoy it, I love being outside. I love walking in nature. I love to be on a greenway system, walking on the parks, whatever, and just looking around, listening to the birds, the smells in the air, all of that. But I also love to socialize with my friends, and so going out on a walk with a group of friends is a great way to do it. But the benefits of doing all of that with poles versus just my 2 feet is that you get more bang for your buck, okay? You are using your legs to exercise, but you're also using your upper body to exercise, okay? So that's why it's so incredible. And for diabetes specifically, we'll get more into that, okay? So you get more muscles activated, and as long as you're engaging with the poles properly, you can engage or activate up to 90% of the muscles in your body. It's pretty crazy to say that you can do that much with just walking with poles, okay? So, more benefits. So the benefits of pole walking for people living with diabetes are numerous. Studies show that the insulin efficiency has been proven to have a carryover of up to 96 hours. That's a big bang for your buck. You are out there walking with poles, and the insulin efficiency isn't just happening while you're doing it, but it is carrying over for 96 hours after your exercise. That's incredible. So we know that we have calorie expenditure with physical activity, but with the poles, you have increased calorie expenditure because you're using more muscles. And this, of course, relates to improvement in weight loss, right? And weight management, and the reduction of waist circumference. This is a big thing these days, right? We take measurements around the abdomen to determine whether or not we are healthy or not. So that helps a lot there. And another benefit is that using poles while walking offers a form of offloading to the lower legs because you're putting some weight into your hands. So this has been shown to reduce pain associated with neuropathy and intermittent claudication. Does anybody know what intermittent claudication means? So that's an action, it's a where the blood vessels are not getting enough oxygen to your lower limbs, and so you end up with this extreme pain in your legs when you've gone and you've done a little bit more activity than usual, and the blood flow is just not keeping up with it. You know, in a nutshell, that's what intermittent claudication is. So the poles offer a little bit offloading for your arthritic joints, but also for the intermittent claudication. So it can be really helpful with that. And pain in the legs for neuropathy. Also, there's research to prove that using poles is known to reduce depression and improve adherence to maintain physical activity goals. It's just more fun than walking alone, right? So that's all there is to it. You got to make the activity engaging and fun for yourself, or you're not going to stick with it. So there's been research to show that people who walk with poles are more apt to go out and do more walking because it's fun. And we're gonna give you a little taste of that if you choose to do so. So on my slide here, you see this insulin efficiency that is proven to carry over for up to 96 hours. Increased calorie expenditure results in weight management and reduced waist circumference, and then reduced pain from the legs. Here's the sheet that you have on your clipboards. This is a little bit more about the pole walking for diabetes, and you feel free to read that at your own pace. That's for you to take home. These poles were developed by Urban Polling Incorporated in Canada by an OT. Are you Canadian?
Yes, ma'am.
So by an OT and a gerontologist. And they have been given the ease of use accreditation by the Arthritis Foundation because the way the handles are, they do take a little bit of your grip strength away because you don't have to like hold something really small. They're a little nicer, arthritis-friendly grip. And I'll have more information on how to purchase them, but you can get them directly from Urban Polling. You can get them from Amazon, but I also sell them myself, so I'll have some information for you on that. Yes, ma'am.
Is there a specific size, like on this short? Is there a specific size, like?
So we're gonna
put into your body?
we're gonna pull them out today, and we're gonna work to see if you can get them at your proper height. But there are specific poles for people who are up to 6'4" because you need a little smaller pole. And there are poles that are specific for a little heavier person so that they have the amount of stability in the pole that they need. But the other thing I want to point out about these is if you do purchase them, check with your insurance provider because a lot of them are being covered under health spending accounts. It is a device that has been shown that it is approved for some health spending accounts. So do you have that?
No DME.
Well, but these aren't really DME.
Right.
This is not DME. This is like, a lot of programs are going more towards a wellness aspect. Like they want people getting physically active, so they'll pay for you to go get your own set of hand weights. Right? They want you to go buy those ankle weights, and they'll pay for it through your health spending account. So this is not DME. This is an activity device. We are trying to be more physically active with it. Not to say that it's not used as a piece of durable medical equipment in a lot of instances. Physical therapists are using them a lot, people that have had a stroke.
Yes.
I mean, it's so much better for our posture than a cane or a walker. You know, like there's just, for certain people, this is the new thing. Like we are really just getting wind of it down here. And I learned about it at the International Council for Active Aging. And there was a physical therapist there who learned about it. She's up in Wisconsin. She takes people out with the poles all the time. She works specifically with people with Parkinson's on these poles. And they do a lot of, the boxing with the poles. They go on walks and hikes outdoors with poles. She's constantly putting up videos of her outdoors with all of these people with the poles in their hands. And so they are a device for people that have a medical instability as well. After total knee replacement, you said you have 2 total knees. So after total knee replacement, once you're ready to graduate from the walker to an assisted device, canes are usually the one that PTs have traditionally gone to. Now it's poles. Like we are trying to get the poles in people's
So
hands.
the polling is going to be our exercise class today?
Part of it.
Yeah.
Part of it. I think we have Tai Chi as well. So sorry. I might have we got started a little late, so. All right, so we are going to get moving with the polls. I'm going to grab some for you guys to use. Please read my disclaimer, and then I also have a waiver that I need you to sign if you